Welcome Internet. Today we're going to be talking about doubt. And not any form of doubt, but doubt both as a patient and a therapist about psychotherapy. So, one thing I would like to clarify before we begin is that doubt is something that is vastly common, both for therapists and for patients. And I don't think, and this is gonna be my a priori for all this video, that's a bad thing. Quite the opposite. I think it's quite an important facet of both the experience of psychotherapy and how you practice psychotherapy. But I'm going to expand on these topics very soon. So, doubt as a patient is very interesting because often patients, at least at the very start of psychotherapy, doubt the process quite a lot, especially if you're doing psychodynamic psychotherapy or psychoanalysis. It is very frequent for patients to say that they don't really understand the concepts of the unconscious, they don't really understand what's the point of it, or why should we explore it. So it is very common for patients to start questioning. Often what happens is that when you give them some form of explanation, some form of thing to basically make sense of those theories, patients then to start to engage in it, and often they start reflecting on themselves. And I think it's not an act of randomness that one leads to the other, because I do think that doubt is the prerequisite for introspection, that it's something that allows us to go deeper in ourselves. And the premise of doubt is to basically start that movement, that we doubt others, so therefore we can also then doubt ourselves and basically question what has happened to us. And when I mean doubt, I don't mean doubt in this obsessive way of finding flaw with what has been done or what should have been done, but more doubt in the sense of being able to question what was unquestionable, to open a door for the patient to be able to basically push back against certain conceptions, certain biases that they might have, or even certain loyalties to the family or to the profession that remained unquestionable before that. So doubting the therapist is the first, in a way, experience of seeing that you are allowed to doubt, you're allowed to question what is happening and what is going to happen in the psychotherapeutic space. And I, as a therapist and a psychologist, I see that as a very positive encounter, as basically the patient is A, secure enough to be able to verbalize the doubt, and B, secure enough to trust the therapist will deliver answers, or at least hypotheses on how the setting works. And also, and this is very important, I think that doubt as a patient has a real place, because sometimes it's also the premise of the fact that something is not working in the dynamic between patient and therapist, between what is happening in the setting. And I think it's also very important to be able to use that doubt to progress, to grow. That if you ever doubt the psychotherapeutic space, it's important, I think, to verbalize it, to be able to get it out there, to see if it's what we call in psychoanalysis resistance, i.e. the patient doesn't want to go further, that the patient does not want to basically, unconsciously of course, want to create distance in a way to try and avoid painful memories, painful introspection, or if, and this is more perhaps to the point, if something is wrong with the dynamic between patient and therapist. That doesn't necessarily mean that the therapist is bad, but it means that something is not working in the process, in the dynamics. And here it's important to say that it's okay to doubt, and it's okay to say that the therapeutic relationship isn't working out, because as it develops, it is often important to look at it, because some therapists are not good matches for certain patients, and vice versa. Certain patients do not match with certain therapists, and that's okay. I really do think that diversity is the spice of life, and in therapy it's very true. That, for example, I've worked with people who had tried other types of therapy and other personalities of therapists, and that didn't work out for them. They were not convinced, or perhaps they felt that the approach or the listening or basically the interactions were not fit for them, and that's okay. In the same way, and this is important, that some people have met me, but I haven't been a good match for them, and that's fine. I mean, it's always frustrating to have to try again and again, but sometimes that's how life goes. You don't succeed the first time round. You basically need to try things again and again and again in order to be able to get a result. And that's also why doubt is so important. It allows us to go on the path of thinking if this is good or not for us. So that's pretty much the question of doubt on the side of the patient. I'm sure there's plenty of things I've missed that you'll be able to put in the comments, but grosso modo, as we would say in French, i.e. the big picture is that one, right? So here we're going to move into doubt on the side of the psychotherapist, the psychologist, the psychiatrist, the mental health professional, which is a very wide topic, because that's not often something that is talked about too much with the patient, but the professional also has doubts, not necessarily on to continue or not to continue with the patient. That's not it. But if the intervention is the good one, if, for example, the interpretation that we are giving the patient is right, if what we're doing also is going to help. Because that's a very interesting thing with psychotherapy, is that it's a space in which doubt is constant. You never really know if you're gonna hit the mark for the patient, or because the patient might not be ready to hear what you have to say, but also because sometimes your interpretations might be off, and that does happen, that you're not going to do a bullseye every time that the patient says something. But in a way, doubt is important, because as it is for the patient, it's also so important for the therapist, because it allows us also to self-reflect, to think, have I done things accurately? Have I myself been, in a way, acting something out towards the patient? Was I replaying something for the patient? Was it my own difficulties that were shining through that interpretation? And it's very difficult, right? And because you have to really look into yourself and really think, have I gone off rails, or has it been okay? Have I made a mistake or not? So those things tend to really stick in your mind, and you start to think about it. Of course, there's always ways to help, like supervision or talking to a colleague, or what we call in France intervision, i.e. groups of therapists that talk to each other and help each other out. So there's ways of alleviating that doubt, or at least answering or partly answering the doubt that is created by the psychotherapeutic situation. But that doubt is so fundamentally important, because it allows us to understand that maybe something has been missed, be it for a good reason or a bad reason, right? But something is not 100% accurate or right. Therefore, we start to question. This questioning can be on a whole range of things. Here I've talked about interpretations, but we could talk also about diagnosis, and how you might be sometimes off with the diagnosis, and it does happen sometimes, that or you're right but it's not the only issue, or you're off because sometimes sins are so basically intertwined that it could be one or the other, right? Doesn't make the person a bad therapist or a bad psychologist, but it's just that it means that there's more refining to do. I also think that doubt is a good countertransferential feeling, because it allows you to try and take a step back from the psychotherapeutic relationship and try and analyze the meta-dynamics, i.e. what role you're playing for the patient, and what the patient is trying to make you play as a role. Are you someone that supports the patient, tries to basically fulfill a parental embargo, or are you on the opposite, of being more distant, perhaps less open and more directive with the patient? And if so, why? And these feelings, even though I'm talking about them very freely here, they're not very easy when you're experiencing them, because you're always under the pressure of, am I doing something right or am I doing something wrong? And I was having a conversation with someone one day about this, and the person asked, so when does the doubt go away? And I answered spontaneously, it never does. And I do believe that there's no point in which we as professionals will reach full extent of knowledge, that we will have all the answers, and that the unknown or the unpredictable will be gone. I don't believe that. I think that doubt is inherent to good psychotherapy. Why good? Well, because of all of what I've said, doubt is a way of introspection and self-reflection. In my experience and in my opinion, therapists that don't doubt tend to be not that good of therapists. At least this is my opinion. Because they don't question themselves. They feel that they merge their intuition with truth. And I think that that's very dangerous. And that because you can have an intuition, and intuitions are very important, especially in the field of psychotherapy, but they're not truths. What I mean by that is that the truth, as a capital T, is not something that is really present in psychotherapy. It's subjective, it's personal. But once you start thinking that you've found the truth, then you superimpose it onto others, because a truth is exclusionary of doubts. Because if you know the truth, you're not going to doubt, are you? You're just going to do something because you know it's right. And after the point where you know it's right, then that means if the other one differs, then what does it mean? That means that they're wrong. And that's a massive problem, because in interpersonal connections, if you're going to start saying someone is right and someone is wrong, then you're going to create space for basically or unfruitful conflict, or basically you're going to push the patient and even yourself as a therapist into a box of them being resistantful and you bringing them the answer. And I think that's I'm going to put it very extremely, but that's kind of catastrophic, because once you do that, you are it's no longer dialectic. It becomes something more rigid, something more complete, and something that's not flexible. And the whole point of mental health is to be able to keep a flexibility. And I think that one of the major milestones and really important aspects of psychodynamic and all forms of psychotherapy is the flexibility, is the fact that the therapist can change and be changed by the patient in the same way that the patient can change and be changed by the therapist, that our opinions, our hypotheses can be molded differently, can with new data shift. And that sometimes we think we have a great idea, and we really do, but it's not a full picture. And doubt helps us to understand that it's not a full picture, that our assertions are more, I don't like to say this, but there's a bit of truth in this, it's more an educated guess, but a guess nevertheless. And therefore, it's very important to have the feedback of the patient, because they know themselves better. They live 24/7 with themselves, so they know quite a bit. And of course, there are always going to be resistance, right, or on interpretations, on certain perspectives, and that's fine. Because the patient does not have to buy what you're saying, just think about it. And that's, I think, what's the most important, is that if the patient can take it in, think about it, accept it or reject it, that's great. That's really basically the doubt and the process has basically been effective. What is ineffective is the patient rejects it, even if it's right or wrong, right? But complete rejection without even giving it a thought. If that's where it becomes more complicated, because it means that the patient does not take the time to basically think about it, to process it. It's directly something that is rejected. And we can see that, for example, in very severe forms of psychopathology, in which any intervention is rejected, is seen as bad, wrong, without even really taking the time to process what is said. That even the fact of being there with the patient is already too much. And the patient in these severe forms of psychopathology doesn't doubt. They think that they have the truth. And that's why I was saying that that's so complicated, because if the therapists themselves think that they have the truth, then they enter in a state of pathology in a way, because there's no flexibility, there's no questioning, there's no rethinking and reprocessing. Because as good a therapist is, they're never going to have the absolute picture. Therefore, the patient has to be able to basically create doubt in the therapist, and the therapist needs to be able to accept that doubt in order to help the patient with their inner investigation. In a way, this doubt is so fundamental because it allows us also to have a sort of check on ourselves, that by doubting we are also, as psychotherapists, renouncing this fantasy of the almighty therapist, which I've already talked about. We are renouncing the fact that we have all the power, all the knowledge, and we are re-giving the patient something. We're re-giving them agency. We're re-giving them trust in the fact that we feel that we feel that they know best. And that, I think, is very important for a whole range of patients. Of course, there's always going to be issues with doubt, with more severe psychopathologies, and some even bordering on personality and very, very severe personality disorders and perversions might instrumentalize, weaponize that doubt of the therapist in order for them to get what they want. And that does exist, and it is a risk with certain very, very specific types of patients. But the same exists for abusive therapists also, that they can instrumentalize the doubt of the patients. But this is neither here nor there, because it's more my video, what I want to share with you is more the relevancy and the importance of still doubting. Even though we know a lot of things and we have a lot of knowledge, we don't know everything. And I think that doubting in psychotherapy is incredibly healthy for the therapist and even for the patient. And that allowing oneself to doubt is the premises of a deep form of introspection. As when we doubt, we question. And when we question, then we can basically challenge what we know. So basically, that's my perspective on doubt. I know that it's not going to be unanimously accepted, but I found it interesting and that's why I wanted to share it. If you have any other perspective or anything you want to talk about or anything you want to basically bring up, feel free to put them in the comments. I'll see you in the next one.